You are preparing for the induction of anesthesia for a 15 kilograms dog undergoing a routine orthopedic procedure. The veterinary surgeon orders the following: propofol for induction and isoflurane for maintenance. The recommended dose for propofol is said, e.g., what is the total volume of propofol required for this dog? Additionally, explain the key considerations for maintaining adequate anesthetic depth during the procedure and how to adjust gas concentrations of isoflurane during maintenance. Answer. Step 1. Calculate the propofol dose. The recommended dose for propofol is AG or 15 kilograms dog. Total propofol requires AGS 15 kg equals Indian G. If the propofol is available in a concentration of mg/ml, volume of propofol equals Indian G ml. Step 2. Maintaining anesthetic depth during the maintenance phase of anesthesia. Isoflurane is typically used for inhalation anesthesia. To maintain adequate anesthetic depth, the concentration of isoflurane should be adjusted based on the dog's response to surgery. The MAC minimum alveolar concentration of isoflurane for dogs is typically 1.3%, but this can vary depending on the age, health, and procedure specifics. Guidelines for gas flow rates. A typical flow rate for maintenance is around 1-2 Lmin of oxygen, and the isoflurane concentration is usually set at 1.5-2.5% depending on the animal's response to surgery. To avoid hypoventilation, monitor the end tidal co and adjust the isoflurane accordingly. Also ensure continuous monitoring of the heart rate, respiratory rate, and blood pressure to adjust anesthetic depth as needed. Veterinary anesthesia guidelines emphasize maintaining a balance between adequate depth and minimal side effects. A 10-year-old cat is brought into the emergency room with signs of respiratory distress, tachypnea, and cyanosis. Upon examination, the mucous membranes are noted to be dark purple, indicating severe hypoxia. What is the first step in triage, and what are the critical interventions that should be prioritized according to the RECOVR guidelines for CPR? Answer. First step in triage. The first step in triage for a patient presenting with severe respiratory distress and cyanosis is to assess the severity of the hypoxia. This involves checking vital signs, including heart rate, respiratory rate, mucous membrane color, and capillary refill time. Given the cyanosis, dark purple mucous membranes, the primary concern is inadequate oxygenation, which requires immediate intervention. Critical interventions. Recover guidelines. According to the RECOVR guidelines, the critical interventions include oxygen therapy. Administer oxygen as soon as possible, ideally using an oxygen cage or a non-rebreathing mask to stabilize the oxygen saturation levels. The aim is to increase the partial pressure of oxygen in the blood and correct hypoxia. Airway management. If the patient's airway is obstructed or compromised, consider advanced airway management, such as intubation, to ensure that oxygen is delivered effectively. Circulatory support. Evaluate the cat's blood pressure and perfusion. In cases of shock or hypoxia-induced collapse, IV fluids may be necessary to restore circulatory volume and improve oxygen delivery to tissues. CPR protocols. If the patient goes into cardiac arrest, perform chest compressions at a rate of 100-120 compressions per minute, ensuring proper depth, about 1-3 the chest diameter, and allowing for full recoil between compressions. Ventilation should be provided with a bag valve mask device delivering 10 breaths per minute. It is critical to follow these guidelines quickly and methodically to improve chances of survival in an emergency situation. Mr. Peters brings his 8-year-old cat, Whiskers, to your clinic for a dental extraction. Whiskers is obese and has a history of heart disease. The veterinarian orders general anesthesia using isoflurane and requires pre-anesthetic blood work to assess the cat's liver and kidney function. Mr. Peters is concerned about the risks of anesthesia, particularly with Whiskers' heart disease. What would you advise Mr. Peters regarding the risks of anesthesia and what pre-anesthetic protocols should be followed to minimize potential complications? Answer. Advice to Mr. Peters. Given Whiskers' obesity and history of heart disease, anesthesia carries increased risks, including poor anesthetic recovery, cardiovascular instability, and difficulty managing fluid balance. Heart disease considerations. An obese cat with heart disease is more prone to anesthesia complications, such as hypotension or arrhythmias. Monitoring of cardiovascular status throughout the procedure is critical. Pre-anesthetic blood work. Blood work should include a complete blood count, CBC, biochemical profile, and urinalysis to assess kidney and liver function, as these organs are involved in drug metabolism and elimination. Given Whiskers' heart disease, assessing electrolytes, especially potassium, is essential to ensure no underlying imbalances that could worsen the heart condition during anesthesia. Pre-anesthetic medications. Administer pre-medications to reduce stress and minimize anesthetic doses. For example, sedatives like acetpromazine may be used to reduce anxiety. Consider using a combination of analgesics and sedatives to reduce the required dose of anesthetic agents. Specific anesthesia protocol. For cats with heart disease, consider using opioids such as buprenorphine for analgesia and benzodiazepines such as diazepam for sedation, as these tend to have minimal effects on cardiovascular stability. The anesthetic dose of isoflurane should be titrated to effect, and monitoring of heart rate and rhythm during anesthesia is crucial. You are managing a trauma case where a dog has sustained severe blood loss from a torn artery in its leg. The dog's heart rate is 180 bpm and the mucous membranes are pale. What is the primary concern in this situation, and what is the most appropriate fluid therapy approach to stabilize this patient in the first hour? Answer: primary concern. The primary concern in this scenario is hypovolemic shock due to blood loss. Hypovolemia leads to reduced circulating blood volume, which compromises tissue perfusion and oxygen delivery. The increased heart rate tachycardia is a compensatory mechanism aimed at maintaining cardiac output, but this is insufficient to counteract the blood loss. The pale mucous membranes suggest that the dog is not adequately perfusing tissues. Fluid therapy approach: initial stabilization. The first hour of treatment for hypovolemic shock should focus on restoring circulatory volume. The most appropriate fluid therapy approach is crystalloid fluids. Begin by administering isotonic crystalloids, e.g. LRS or saline, at a rapid rate. A typical starting dose is 2030 AG over the first 1-5-3 minutes, assessing the response to treatment as you go. The aim is to stabilize the patient's cardiovascular function. Colloids. If the dog does not respond to crystalloids within the first 30 minutes, consider adding colloid solutions, e.g. hetastarch or plasma, to help expand the intravascular space more effectively. These are particularly beneficial if there is ongoing bleeding or if crystalloids alone are insufficient. During a surgical procedure, a dog receives general anesthesia with isoflurane. The dog begins to show signs of hypotension, low blood pressure during surgery. What are the most common causes of hypotension under general anesthesia, and how should you manage this situation according to standard anesthetic protocols? Answer: common causes of hypotension. Several factors can contribute to hypotension during anesthesia. Vasodilation from anesthetic agents, isoflurane and other inhalant anesthetics cause vasodilation, which can lead to a decrease in systemic vascular resistance and result in low blood pressure. Hypovolemia, blood loss during surgery, or inadequate fluid administration can decrease circulatory volume and cause hypotension. Cardiovascular depression. Anesthetic agents can suppress myocardial function, particularly if the animal has underlying heart disease. Management of hypotension. The first step is to assess the underlying cause, increase the rate of fluid administration, crystalloids or colloids, to improve blood volume and perfusion pressure, reduce the depth of anesthesia by decreasing the concentration of isoflurane to minimize vasodilation. If these measures are insufficient, consider inotropic support with drugs like dopamine or dobutamine to improve myocardial contractility. A 3-year-old Labrador presents with severe vomiting and diarrhea and is found to be severely dehydrated. What diagnostic tests should be prioritized to assess the cause of dehydration, and what is the initial step in fluid resuscitation based on the clinical presentation? Answer: diagnostic tests. The first priority in assessing dehydration in a dog with vomiting and diarrhea is to determine the underlying cause. The following diagnostic tests should be performed. CBC and biochemistry panel. These tests will help assess the extent of dehydration, electrolyte imbalances, and any systemic infection or metabolic disturbances, e.g. kidney function. Fecal examination, to rule out parasitic infections or bacterial pathogens that could be causing gastrointestinal upset. Abdominal ultrasound or X-ray. If the foreign body or other abdominal pathology is suspected, imaging can help identify the issue. Initial step in fluid resuscitation. Given the clinical presentation of dehydration, the first step is to administer intravenous fluids to correct fluid and electrolyte imbalances. Isotonic crystalloids, LRS or saline, are typically used initially. The typical fluid rate for a dog with severe dehydration, e.g. 1012% dehydration, is 406 AR initially, with careful monitoring to avoid overhydration. As the dog stabilizes, fluid rates should be adjusted based on ongoing losses and clinical signs. MS. Carson brings her 6-month-old kitten, Whiskers, to the clinic after noticing lethargy and a decreased appetite. On examination, Whiskers is hypothermic, body temperature of 34 deg, and the mucous membranes are slightly pale. Heart rate is 160 bpm and respiratory rate is elevated. What is the likely diagnosis and what immediate actions should you take to stabilize Whiskers? Answer: likely diagnosis. Based on the clinical signs, Whiskers is likely suffering from hypothermia and possible shock due to an underlying infection or other acute illness. The low body temperature suggests that the kitten's body is struggling to maintain normal physiological function, often seen in critical illness. The pale mucous membranes may indicate poor circulation and oxygenation. Immediate actions to stabilize Whiskers: warm the patient. Gradually raise Whiskers' body temperature using warm blankets, heat pads, or a heated cage. Avoid rapid warming as this can cause shock. IV fluids. Administer warm isotonic crystalloids to restore circulatory volume and maintain perfusion. Monitor and adjust. Constantly monitor heart rate, respiratory rate, and temperature. Ensure Whiskers remains warm and hydrated. If signs of infection are suspected, initiate broad-spectrum antibiotics once a diagnosis is made. In what situations should you avoid using NSAIDs, e.g., meloxicam or carprofen for analgesia in veterinary patients, and what are the potential risks associated with their use? Answer: situations to avoid NSAIDs. NSAIDs should generally be avoided in patients with pre-existing kidney disease due to renal toxicity, liver dysfunction due to hepatic metabolism of NSAIDs, gastrointestinal disorders. NSAIDs can cause gastric ulceration, dehydration. NSAIDs reduce renal blood flow and can worsen kidney function. Pregnancy. NSAIDs can affect fetal development, particularly in late pregnancy. Potential risks. NSAIDs inhibit COX-1 and COX-2 enzymes, which can lead to gastric ulceration, kidney toxicity, and liver damage. Use of NSAIDs must be carefully monitored, especially in patients with predisposing conditions. You are treating a dog in severe septic shock. The dog is hypotensive, with a heart rate of 140 bpm and weak pulses. What initial therapy should you administer, and why are broad-spectrum antibiotics important in this situation? Answer: initial therapy. The first step in treating septic shock is to stabilize the patient's circulation by administering IV fluids, crystalloids at a rapid rate to restore intravascular volume. Colloids may be added if the response to crystalloids is insufficient. In cases of sepsis, vasopressors like dopamine or norepinephrine can be used to support blood pressure if it remains low despite fluid resuscitation. Broad-spectrum antibiotics. Broad-spectrum antibiotics are crucial in septic shock because they target a wide range of potential pathogens, bacteria, fungi, etc. that could be causing the infection. Early administration of antibiotics is key to preventing further systemic inflammation and organ failure. A 6-year-old boxer presents with severe tachypnea, coughing, and fluid accumulation in the abdomen. On auscultation, crackles are heard in both lung fields and the dog's heart rate is elevated. What is the most likely diagnosis and what are the key treatment steps? Answer: most likely diagnosis. This dog most likely has congestive heart failure, CHF, possibly due to dilated cardiomyopathy, common in boxers. The tachypnea, cough, and abdominal fluid accumulation sites are all consistent with heart failure leading to pulmonary edema and fluid retention. Key treatment steps: oxygen therapy. Administer oxygen via face mask or nasal cannula to improve oxygenation as pulmonary edema is impairing gas exchange. Diuretics. Furosemide, a loop diuretic, should be used to reduce fluid overload, including ascites and pulmonary edema. Vasodilators. Consider nitroglycerin or enalapril to reduce preload and afterload, which will ease the burden on the heart. Inotropic support. If necessary, dobutamine or dopamine may be used to improve myocardial contractility in the case of severe heart failure. Monitoring. Closely monitor vital signs, including blood pressure and respiratory rate, to adjust therapy as needed. Explain the role of the pancreas in the digestive system and discuss the consequences of pancreatic insufficiency in dogs. Answer: the pancreas functions both as an endocrine and exocrine gland. Its exocrine function involves the secretion of digestive enzymes amylase, lipase, proteases into the small intestine to aid in breaking down carbohydrates, fats, and proteins. The endocrine function includes the production of insulin and glucagon to regulate blood sugar levels. Exocrine pancreatic insufficiency (EPI) is a condition where the pancreas fails to produce enough digestive enzymes. This leads to malabsorption of nutrients, resulting in chronic diarrhea, weight loss, and poor coat quality despite an increased appetite. Affected dogs may also have steatorrhea, fatty stools. Diagnosis involves enzyme tests such as serum trypsin-like immunoactivity (TLI). Management typically includes enzyme supplementation such as powdered pancreatic enzyme products and a highly digestible diet to assist digestion. Without treatment, a PI can lead to malnutrition, vitamin deficiencies, and secondary conditions like bacterial overgrowth. Early diagnosis and dietary intervention are critical in managing this condition. What are the signs of fear in a dog during handling, and what techniques should be applied to ensure both handler and animal safety? Answer: signs of fear in dogs include body language, cowering, tail tucked between legs, ears flattened, avoiding eye contact. Physical symptoms: trembling, excessive drooling, or panting. Behavioral signs: growling, snapping, or trying to escape. Handling techniques to ensure safety: approach calmly, avoid sudden movements or direct eye contact, which may be perceived as threatening. Use a leash and muzzle. A muzzle should be used if the dog is fearful and likely to bite. The leash should be used for control, gentle restraint. For fearful dogs, use minimal restraint, such as placing a hand under the chest for support while avoiding any pressure that might increase stress. Positive reinforcement: reward calm behavior with treats or praise, reinforcing that handling is not threatening. Preventive care includes training the dog to be comfortable with handling, which can reduce stress during clinical visits. Creating a calm environment and using low-stress handling techniques are key to preventing fear-induced aggression. Lucy, a 5-year-old Labrador retriever, is brought to the clinic with a history of vomiting, diarrhea, and lethargy. The owner mentions Lucy ate a significant amount of table scraps over the weekend. A physical examination reveals abdominal tenderness, and a blood test shows elevated lipase levels. What is the likely diagnosis, and how should Lucy be managed? Answer: the likely diagnosis is acute pancreatitis, a condition in which the pancreas becomes inflamed, often triggered by a high-fat meal. The elevated lipase levels are indicative of pancreatic injury or inflammation. Management involves fluid therapy, rehydrating the dog and correcting electrolyte imbalances through intravenous romanoids. Pain management: using pain-relieving medications such as opioids or NSAIDs to manage discomfort and prevent further stress on the pancreas. Nutritional management: once vomiting subsides, gradually reintroduce food, starting with a low-fat, easily digestible diet. This helps reduce the strain on the pancreas. Antibiotics: administering antibiotics if there is concern about secondary infections due to bacterial translocation from the intestines. In severe cases, hospitalization may be required for monitoring, including the use of antiemetics, electrolyte monitoring, and pancreatic enzyme supplementation. The prognosis for acute pancreatitis varies depending on severity, but early intervention improves outcomes. Describe the proper technique for safely handling a medium-sized parrot and explain the rationale behind each step. Answer: proper handling of a medium-sized parrot requires careful attention to minimize stress and prevent injury. Approach calmly. Parrots are highly sensitive to rapid movements. Move slowly to avoid startling the bird. Use a towel. Gently drape a towel over the bird's body to help secure its wings and reduce stress. This minimizes the risk of injury from flapping or struggling. Support the bird's body with one hand under the bird's chest and the other controlling the head. Hold the bird securely but without excessive pressure. Ensure the bird can breathe freely. Minimize stress. Limit handling time and keep the bird in a quiet, calm environment to reduce anxiety. Rationale: these techniques prevent the bird from injuring itself by flapping its wings, which can cause fractures, and ensure that the bird feels secure, reducing the risk of aggressive behavior. Prolonged or aggressive handling can lead to feather plucking or biting. Discuss the mechanism of gas exchange in the alveoli and its relevance to respiratory diseases such as pneumonia. Answer: gas exchange in the alveoli occurs by diffusion, where oxygen from the air passes through the alveolar walls into the capillaries, binding to hemoglobin in red blood cells. Conversely, carbon dioxide diffuses from the blood into the alveoli to be exhaled. This process is driven by concentration gradients, with oxygen moving from areas of high concentration alveoli to low concentration capillaries, and carbon dioxide moving in the opposite direction. In pneumonia, inflammation of the alveoli, often caused by bacterial or viral infections, leads to fluid buildup and consolidation in the lung tissue. This reduces the surface area available for gas exchange, leading to hypoxia, low oxygen levels in the blood, and respiratory distress. Clinical signs of pneumonia in animals include coughing, labored breathing, and fever. Treatment generally includes antibiotics for bacterial causes, supportive care like oxygen therapy, and anti-inflammatory drugs to reduce lung inflammation. Pneumonia can result in severe complications such as respiratory failure if left untreated. What physiological indicators suggest chronic stress in cats, and how can these be mitigated in a clinical setting? Answer: chronic stress in cats manifests physiologically through increased cortisol levels. Chronic activation of the stress response can suppress the immune system, making the cat more susceptible to infections. Gastrointestinal disturbances. Stress may cause diarrhea or anorexia as the gastrointestinal system becomes affected. Behavioral changes. Cats under stress may exhibit excessive grooming, aggression, or hiding. To mitigate stress in the clinical setting, gentle handling, use low stress techniques like towel wrapping and avoid excessive restraint. Provide hiding spaces. Cats feel more secure when they have a place to retreat to. Use crates or covered areas to mimic familiar environments. Pheromones. Products like Feliway can help reduce anxiety by mimicking natural calming scents. Quiet environment. Minimize noise and sudden movements which can trigger stress responses. Compare and contrast the types of joints found in a dog's forelimb and their common disorders. Answer: the dog's forelimb contains several types of joints. Ball and socket joint. Located in the shoulder, this joint allows a wide range of motion. Common disorders include arthritis and luxation, dislocation, hinge joint. Found in the elbow, this joint only allows flexion and extension. Elbow dysplasia is a common disorder in growing dogs, which can result in pain, lameness, and arthritis if untreated. Gliding joint, located in the carpus, wrist. This joint allows limited movement. Sprains or fractures can occur if the joint is subjected to excessive force or injury. Joint disorders in dogs are commonly diagnosed through radiographic imaging, and management involves pain relief, NSAIDs, physical therapy, and in some cases, surgical intervention. Explain the physiological differences between the venous and arterial systems in dogs and their relevance in clinical procedures. Answer: the arterial system carries oxygenated blood from the heart to the tissues under high pressure. Arteries have thick muscular walls to withstand the pressure and maintain the blood flow with a pulse that can be palpated. The venous system returns deoxygenated blood to the heart at low pressure. Veins have thinner walls and contain valves that prevent blood from flowing backward. In clinical practice, arterial blood samples are typically taken for blood gas analysis due to their oxygen-rich content. The radial or femoral arteries are commonly used. Venous blood samples are more commonly drawn for general laboratory tests. Cephalic or jugular veins are preferred due to their accessibility and low risk of complications. Both systems are essential in various diagnostic and therapeutic procedures, requiring careful handling to prevent complications such as hematomas or thrombosis. Discuss the significance of hydration status in dogs and how dehydration can affect organ function. Answer: hydration is crucial for maintaining normal cellular functions, thermoregulation, and metabolic processes. In dogs, dehydration can result from insufficient water intake, excessive loss, vomiting, diarrhea, panting, or both. Signs of dehydration include dry mucous membranes, sunken eyes, and loss of skin elasticity. Dehydration negatively affects kidney function. Reduced blood flow to the kidneys leads to renal insufficiency. Cardiovascular function. The heart must work harder to pump blood, leading to hypotension and possible shock. Gastrointestinal function. Dehydration impairs nutrient absorption and increases the risk of gastrointestinal stasis. Hydration can be restored through oral rehydration in mild cases and intravenous fluids for severe dehydration. Monitoring and addressing the cause of dehydration are critical to prevent organ damage. What is the significance of assessing body condition score (BCS) in veterinary practice? Answer: the body condition score (BCS) is a system used to assess a dog's weight and overall health based on visible and palpable indicators of fat and muscle mass. The scale typically ranges from 1 emaciated to 9 obese. BCS is critical for diagnosing obesity. Overweight dogs are at risk for diseases like diabetes, osteoarthritis, and cardiovascular issues. Monitoring disease progress. BCS helps track weight loss or gain, crucial in managing conditions like chronic kidney disease or cancer. Guiding nutrition. Tailoring diet plans to maintain an optimal BCS can improve overall health and longevity. By assessing BCS regularly, veterinarians can detect weight-related health problems early and provide appropriate treatment plans. Describe the correct method for collecting a blood sample from the cephalic vein of a dog. Discuss potential complications and how to mitigate them. Answer: steps. Restrain. Position the dog securely with one person holding the forelimb to extend the cephalic vein. Asepsis. Clean the puncture site with 70% isopropyl alcohol to reduce infection risk. Vein occlusion. Apply pressure proximal to the puncture site to distend the vein. Needle insertion. Insert the needle bevel up at a 2-euro, 3-aerodig angle into the vein, watching for blood flashback. Blood collection. Slowly draw blood into the syringe, ensuring no air bubbles. Release occlusion. Remove pressure before withdrawing the needle to minimize hematoma formation. Of aftercare. Apply pressure on the site for 3–60 seconds post-collection. Complications and mitigation. Hematomas. Apply consistent pressure after withdrawing the needle. Vasovagal response. Keep the dog calm and monitor for distress. Contamination. Strict aseptic technique is essential. Emily, a veterinary nurse, observes that a colleague has administered an incorrect dose of sedative to a cat scheduled for surgery. The colleague hesitates to report the error, fearing disciplinary action. What steps should Emily take according to veterinary ethics and professional standards? Answer: Emily should prioritize patient safety, immediately inform the veterinarian in charge so corrective measures can be taken, document the incident, accurately record the event in the patient's medical record, report the error, follow the clinic's reporting protocol ensuring transparency, support a culture of accountability, encourage the colleague to report the error as well, emphasizing learning from mistakes. Relevant standards. The Veterinary Nurses Council of Australia (VNCA) Code of Professional Conduct mandates that patient welfare is the primary concern, as must be disclosed promptly to mitigate harm per RCVS Royal College of Veterinary Surgeons Guidelines. What is the primary risk of using acepromazine as a pre-anesthetic agent in brachycephalic breeds, and how can it be mitigated? Answer: risk. Acepromazine can cause excessive sedation and hypotension, which are particularly dangerous in brachycephalic breeds prone to airway obstruction. Mitigation: dose adjustment. Use the lowest effective dose, accounting for breed-specific sensitivity. Pre-oxygenation. Ensure adequate oxygenation before induction. Monitoring. Continuously monitor respiratory and cardiovascular parameters. Explanation: the use of acepromazine must align with anesthetic guidelines, such as those from the American College of Veterinary Anesthesia and Analgesia (CVA), which stress individual patient assessment to minimize risks. What are the key steps to ensure sterility when preparing surgical instruments, and what is the significance of autoclave validation? Answer: steps. Cleaning. Remove organic debris using enzymatic solutions. Inspection. Check instruments for damage or residue. Packaging. Wrap instruments in autoclave-compatible materials. Sterilization. Use an autoclave set to 121°C at 15°C for 15 minutes or equivalent cycles. Storage. Store in a sterile environment until use. Autoclave validation. Validation ensures the sterilizer achieves parameters necessary to kill microorganisms. Biological indicators, e.g., spore tests, are the gold standard. Explanation: following a VA sterilization protocols reduces infection risks and ensures compliance with health regulations. Outline the steps for performing CPR on a medium-sized dog and explain the significance of the RE/COVE guidelines. Answer: performing CPR on a medium-sized dog involves these key steps. Assess for signs of cardiac arrest. Look for no pulse, no breathing, and unconsciousness. Position the dog. Place the dog on its right side, lateral recumbency, for effective compressions. Chest compressions. Use both hands to compress the chest, applying force at a depth of about 1/3 to 1/2 of the chest width at a rate of 100–120 compressions per minute. Ventilation. Provide 10 breaths per minute, ensuring that the airway is open, and using either a mouth-to-snout technique or an ambu bag. Reassess. After 2 minutes of CPR, stop to check for signs of circulation or breathing. Repeat CPR if needed. The RE/COVE guidelines are evidence-based protocols that provide standardized methods for veterinary CPR. These guidelines, developed by the American College of Veterinary Emergency and Critical Care, ensure that veterinary professionals follow scientifically supported, effective methods during emergency situations. The use of these guidelines has been shown to improve survival rates and outcomes in critically ill animals. What is the purpose of performing a urinalysis on a dog presenting with vomiting, lethargy, and reduced appetite, and how can you interpret the results of specific gravity and urine pH in relation to kidney function? Answer: a urinalysis is a valuable diagnostic tool for evaluating kidney function, especially in a dog showing signs such as vomiting, lethargy, and reduced appetite. These symptoms may indicate kidney disease or dehydration, and urinalysis can provide insights into these conditions. The primary components of a urinalysis include specific gravity (SG). This measures the urine's concentration. Normal SG ranges from 1.15 to 1.45 in dogs. A low SG below 1.15 suggests that the kidneys are not concentrating urine properly, which is often seen in renal failure or dehydration. In contrast, a high SG can indicate dehydration or a concentrated urine sample. Urine pH. The pH of urine can vary, but it generally ranges from 5 0.5 to 7.0. Acidic urine, low pH, can be seen in conditions like metabolic acidosis or dehydration, while alkaline urine, high pH, may indicate a urinary tract infection or kidney disease. By evaluating the specific gravity and pH, along with other urinalysis parameters e.g., protein, glucose, and blood levels, the veterinary professional can assess the degree of kidney dysfunction and make informed treatment decisions. Explain the principle of aseptic technique during a sterile surgery and why it is crucial for preventing surgical site infections. Assis. Answer. Aseptic technique during surgery is a series of practices aimed at preventing contamination and maintaining a sterile environment. It is essential for reducing the risk of surgical site infections, assis, which can lead to complications such as delayed healing, increased hospital stay, and more severe health issues for the animal. Key elements of aseptic technique include sterile field. The area surrounding the surgical site must remain free of microorganisms. This is achieved by sterilizing surgical instruments and draping the area with sterile cloths. Hand hygiene. Surgical staff must wash their hands thoroughly and wear sterile gloves to minimize the introduction of pathogens. Use of sterile equipment. All surgical instruments, as well as the surface on which the procedure is conducted, must be sterilized using methods such as autoclaving, minimizing air contamination. The operating room should have a controlled environment with the air filtered to reduce the risk of airborne pathogens. Following these practices ensures that pathogens from the environment, surgical staff, or instruments do not contaminate the surgical site, thus significantly lowering the risk of ascis. What are the key components of the triage process when assessing an animal in an emergency situation, and how do these components guide immediate treatment decisions? Answer. Triage is the process of rapidly assessing an animal's condition in an emergency situation to prioritize care based on the severity of the condition. This process helps ensure that the most critical patients receive immediate attention. The key components of triage include airway. Check if the animal's airway is open. If the animal is struggling to breathe, it must be addressed immediately by clearing the airway or providing oxygen. Breathing. Assess the animal's respiratory rate and effort. If the animal is hypoxic or not breathing, artificial ventilation may be needed. Circulation. Evaluate the animal's heart rate, blood pressure, and capillary refilti (CRT). Signs of shock e.g. weak pulses. Prolonged CRT may indicate a need for immediate intravenous fluid resuscitation. Disability. A rapid neurological examination should be performed to detect signs of trauma, alter mental status, or neurological deficits. Exposure. Examine the animal for external injuries, bleeding, or hypothermia. Immediate wound care, such as pressure bandaging or warming, may be necessary to stabilize the patient. The primary goal of triage is to stabilize the patient and prevent deterioration. By following this system, veterinary professionals can make informed decisions regarding which interventions are needed first, prioritizing life-saving treatments. This method, widely used in human and veterinary emergency medicine, is detailed in the Veterinary Emergency and Critical Care Society (VECS) guidelines. Explain the concept of sterile field and how maintaining it contributes to successful surgical outcomes. Answer. A sterile field refers to an area that is kept free of microorganisms to prevent contamination during surgery. It is a fundamental concept in aseptic technique, which is designed to reduce the risk of surgical site infections, ascis, and improve patient recovery. The sterile field is created by sterilizing instruments. Surgical tools, including scalpels, forceps, and scissors, are sterilized using methods such as autoclaving to eliminate microorganisms. Sterile draping. The surgical site and surrounding area are covered with sterile drapes, leaving only the surgical area exposed. Personnel sterile attire. Surgical staff wear sterile gloves, gowns, face masks, and hair covers to prevent contamination from their clothing or body. Maintenance during surgery. The sterile field must be maintained throughout the procedure. Any break in sterility, such as a contaminated instrument or touch by non-sterile personnel, must be addressed immediately by re-sterilizing or replacing instruments. Maintaining a sterile field minimizes the risk of introducing pathogens into the surgical site, significantly reducing the chance of ascis. What is the primary difference between hypovolemic shock and cardiogenic shock in a veterinary patient, and how would you manage each condition differently? Answer. Hypovolemic shock and cardiogenic shock are both life-threatening conditions that result in inadequate tissue perfusion, but they have different underlying causes and management strategies. Hypovolemic shock. This occurs when there is a significant loss of blood or other body fluids, such as in cases of severe hemorrhage, dehydration, or gastrointestinal fluid loss. The primary issue is a decreased circulating blood volume, leading to reduced venous return, cardiac output, and oxygen delivery to tissues. Management. The main treatment goal is to restore blood volume through fluid resuscitation. This is typically achieved with intravenous fluids, such as crystalloids, e.g. lactated Ringer's solution, or colloids, e.g. synthetic plasma expanders. Blood transfusions may be necessary if there is significant blood loss. The animal may also require medications to support blood pressure and improve circulation. Cardiogenic shock. This occurs when the heart is unable to pump blood effectively, leading to insufficient oxygen delivery to tissues. Common causes include heart failure, arrhythmias, or myocardial infarction. Management. Treatment focuses on improving cardiac output and supporting the heart. This may involve the use of inotropic drugs, e.g. dobutamine, to improve heart contractility, vasodilators to reduce preload, and other supportive therapies to stabilize the patient. It is essential to address the underlying cause, such as correcting arrhythmias or managing heart disease. Both conditions require urgent intervention, but fluid management is the cornerstone of hypovolemic shock, while cardiac support is critical in cardiogenic shock.